Hey, it's Golda. Before we start this episode, I wanted to say thank you to the listeners who emailed Overlooked and sent in voice memos to share their cancer stories. Stay tuned to the end of this episode to hear those stories.
Do I have a fever? Feel my forehead.
This is Pamela Esposito-Amery.
I've had surgeries before, so it was okay. I was a little groggy, but I was fine.
Picture this, a hospital ward in the recovery room. Pamela has just had a full hysterectomy, a removal of the fallopian tubes, ovaries, uterus, and cervix. But the removal of only one of these organs triggers menopause. You guessed it, the ovaries.
So surgical menopause, you sort of wake up out of surgery and you can be in menopause that instantly. I will never forget, I think they said I could start walking around or whatever it was. I was getting up off the stretcher and I was up for a few minutes and I looked at my husband, I looked at the nurse and I was like, I feel like I'm burning up all of a sudden. And then it was gone like that. And the nurse looked at me and she goes, that was probably your hot flash. And it was gone in an instant. So I was like, oh, this is what it feels like.
Welcome to menopause, eh? And welcome to Overlooked. I'm Golda Arthur. In this episode, Pamela and I talk about surgical menopause, which is brought about by surgery to prevent cancer. Pamela is the CEO and co-founder of an organization called Tell Every Amazing Lady About Ovarian Cancer, or T.E.A.L for short. Pamela and I are in the same boat because I'm in surgical menopause too, since I have a genetic predisposition to cancer. But we're also completely different cases, and you'll hear more about that soon. And for those longtime listeners, you'll remember Pamela from the first season of Overlooked. This time around, though, we talk menopause, cancer prevention, and how to talk to a doctor about all of this. We're at the T.E.A.L Community Center in Brooklyn, New York, on this blinged out, fabulous teal couch. And I'm super excited to get into the conversation about women's health with you today. Before I had my surgery, you and I had a conversation. And I remember being so grateful to you for that conversation because we do all have this fear of the unknown, as you and I have talked about before. And that just really steadied me talking to you, and I remain grateful for that. I wanted to talk about prophylactic removal of the ovaries and fallopian tubes as well, because this puts you into menopause. The removal of the ovaries puts you into menopause. And so it's like, click, instant menopause. There you are, right? Mm-hmm. And you and I have both had this experience, even though our family history is a little bit different. Our genetics are a little bit different. So let me start there. Let's start with your genetics and how you realized that this needed to be done for yourself.
Yeah. So I can tell a little bit about my story, but it's also connects to a wide range of the general public where my sister had cancer. She happened to have ovarian cancer. So when she was diagnosed, she had conversations with her doctors and they advised that she get genetic testing done. Well, she was positive for something called Lynch syndrome. So then they advised, hey, how about you get other people in your family to test for it too, because there might be others. So myself and some other family members got tested. And I learned that I had Lynch syndrome. And from that moment on, all of my doctors were telling me, you should have you should need a hysterectomy and have it as soon as you can. And I was not ready or prepared for that information. But the sort of point of this story is it started out with my sister's diagnosis and it's sort of helping to figure out her cancer treatment, what kind of chemotherapy that she should have, what course of treatment she should have, because that's where science is going and has really improved in many ways. So I offered to get tested too because they were trying to also find connections to her treatment. So then when I got my advice and my answers that I was positive and I should have this surgery done, I knew, and many of you should know, is you do it when it's right for you. Even though the doctors were telling me you should have a hysterectomy, it was a risk-reducing hysterectomy. It was not something that there was an exact reason besides genetics and a high risk. It was to reduce my risk and to try to do it around the same age, or at least a little before the same age that my sister was diagnosed with her cancer, which was young in her 40s. So I waited many years until I was ready. And when I decided to have that done, it was a personal choice. So we highly advise and speak to a genetic counselor who can give you that guidance and support and figure out if genetic testing is even right for you to begin with. Now, we had a strong family history of not only ovarian cancer, but colon cancer as well. We later found esophageal cancer and prostate cancer. So we started to see the threads within the family, and we learned some of that in a genetic counseling session. We drew the family tree, and it's a very relaxed environment and important for families to think about if that's appropriate for them.
What is Lynch syndrome? Tell me a little bit more about that.
Sure. So many people might have heard of BRCA. That Angelina Jolie actually came out with a New York Times op-ed many years ago that she had a family history and she got genetic testing done. So I mentioned BRCA because Lynch syndrome and BRCA are very similar. They just increase your risk for certain cancers. So BRCA, using Angelina Jolie as an example, she has a strong family history of breast and ovarian cancer. Her mother, her grandmother, and her aunt all had ovarian cancer or breast cancer. And so she decided to get genetic testing done. She found that she has BRCA in her family, and so she decided to have what's called an oophorectomy, where she removed her ovaries and her fallopian tubes. And then later on, she wound up having a mastectomy. So those were prophylactic surgeries. She did not have cancer, but she reduced her risk tremendously from these, a surgical procedure. And so Lynch syndrome is sort of similar. Lynch syndrome actually increases your risk for colon cancer and ovarian cancer and many others, just like BRCA as well. There's just a lot of cancers, but those are sort of like the top tier high numbers. Uterine cancer is pretty high for Lynch syndrome as well. So when I decided to have my hysterectomy, it was highly advised not to just remove the ovaries, but also the uterus as well. And then we wound up actually removing everything because the risk was there.
And so my side of the story is that my genetic mutation is RAD51C, which is fairly rare, I think. Although I will say when I in the middle of Overlooked, I got an email from somebody in Australia to say that they also had RAD51C, and so it helps me feel a little bit less rare. But something you said that I'm really curious about, you talked about being ready for it. And I know it took me a long time to feel like I was ready for it. What about you? When did you know that you were ready for it? Was it a gradual realization, or was it sort of a moment of clarity?
Well, when I found out, when I got genetic testing done and they told me that I should have a hysterectomy at some point, I knew it was going to be when, but not if. It was, I kind of talk about it when I have the surgery, not if I'm going to have the surgery. So I knew I would do it, knew in my heart it was the right thing to do because my sister had died from ovarian cancer, that I should protect myself in the little ways we can because there's no screening test for ovarian cancer. So I did a lot of research, and I also not only researched the surgery and the genes that I had and really understanding that, but also what would happen after the surgery because you go into surgical menopause. And so those sort of things were important for me to talk with all of my doctors about. I have specialists in different areas. I've got other health conditions myself. And so needed to make sure that I was doing it at the right time in the right way and had to feel really comfortable with it. So for anybody, even considering this, it is a personal choice. It could be advised to you if there's a strong family history, but it's really important to just educate yourself about it and feel really comfortable.
It is such a big decision, right? And it's not a decision that you can go back on. So obviously being ready for it is important. I'm thinking back now, was I ever actually truly ready? I know I said I was ready. I'm not sure that I was. One thing that makes a big difference is the medical professional that you're working with. And I had a truly excellent gynecologic oncologist working with me who made me feel steady every step of the way. He answered questions I didn't know I even had. And that's a big deal for me because I always have a lot of questions. Yeah. So I think I felt like I was in safe hands. And that feeling of safety and like this, what is a life decision, what is a body decision is just crucial, isn't it?
Absolutely. There were things that I also didn't know. I had a very interesting question pretty close to before surgery that I never even thought about was, do I want to keep my cervix or not? And I was like, oh, but didn't even know how to think about hold on a minute now. I had to sort of regroup and figure out what to do with that. And I did ultimately decide to take everything. So case by case and very individually, because of my exact gene that I have, certain risk factors were there. I had decided to take everything. So a total full hysterectomy. There's different kinds of hysterectomies too. And again, I'm not a doctor. I can't give medical advice, but it's important to ask those questions. What kind of surgery might be appropriate for someone if you're even at that point of asking about that? A lot of other questions could come up.
So let me ask you a personal question. What was it like after the surgery? What was the menopause experience like for you?
First of all, you just go through surgery like any surgery. You're very unable to do a lot of things.
It's hard.
Not going to sugarcoat it. You must have someone with you. And then it just gets better and better from there as you give yourself that space and that time to rest and recover and take care of yourself and heal. You need to give yourself that space and that time to heal and rest and recover like any surgeries, and really pay attention to the cues of what they tell you when you go home from surgery and do those things. So surgical menopause, you sort of wake up out of surgery and you can be in menopause that instantly. It could take some time to see symptoms, but that is pretty much what could happen. And, we have to remember that there's also a lot of women who've had cancer who have surgical menopause because they had to have their ovaries out or their uterus out or some other organ because of cancer. So they also are waking up in surgical menopause. We're so blessed and thankful that we were able to do this prophylactically. And as the months went on from my surgery, different types of symptoms would arise that I realized was menopause. It actually, my first description was I literally felt like I had a fever. I was just burning up and then it was gone. I was like, okay, if that's the worst of it, it wasn't so bad because it does go away quick. For many, many months after that, I had a lot of hot flashes. They didn't really bother me that much. I felt like after other things I had been through, that was not a big deal. Some women really can't take the hot flashes and maybe it's the worst for them. But I find hot flashes where they come and they go very quickly.
Yeah.
And so I worked very closely with my endocrinologist who got me on hormone supplements to kind of regulate some of my hormones that now my body wasn't producing.
So I have a nerdy follow-up question. Why did you choose to see an endocrinologist as opposed to a gynecologist?
Great question. So I, like many women, went on the journey of trying to find a doctor who would understand me and listen to me. And so I stopped when I found a great endocrinologist who really heard me.
Right.
Because they weren't listening. I went from one doctor to the next, to the next, to the next. And I'm very knowledgeable. I also am at a foundation. I have a lot of resources at my fingertips, and I still struggled and went for the second opinion, the third opinion, the fourth opinion, and finally landed on my amazing endocrinologist that has really helped me over the years now to just find what I needed.
I love that story about how you kind of looked for someone who heard you. That's super important. So for me, it's been about, a few months since my surgery. For you, I think a couple of years. Has it changed how you see your body?
Definitely. It's like the pre-surgery body and the after-surgery body. I definitely have found that I really need to pay attention to the foods that I eat, and exercising is so much more important. And I don't say that lightly. I actually can feel differently if I eat certain things. Trying to cut back on sugar or something. I actually was finding for a while if I ate certain things, my hot flashes would be worse. And, doing different dietary adjustments made me feel better. So I've worked really hard on that. And then also exercise. So the body's definitely different. You sort of have other symptoms that pop up and you question, is that menopause? Is that something else? What's happening here? And I think we pay attention more to our body after a surgical menopause because we're not sure. And menopause is sort of this unknown abyss to a lot of women with so many symptoms, and a lot of things just get, sure, that's probably menopause. Sure, that's probably menopause. We have to be careful with that because it could be something else. And we don't want to worry about everything, but it is still important to check with your doctor on.
Yeah. So I want to take this back to the fact that, so here we are, you and me, on the T.E.A.L couch in your community center in Brooklyn. And, we met going back 6 years now. We met going back because I was thinking about making this podcast. And here we are without our ovaries on the teal couch, with my mother having ovarian cancer and your sister had ovarian cancer.
Mhm.
So really the fact that we're in surgical menopause as a way to prevent us from getting ovarian cancer,
Mhm.
in one way, that's kind of a marvel of science,
Absolutely.
isn't it? Because for the longest time, we didn't understand this cancer at all. We had no foothold in how to try and start to diagnose it and screen it and solve it. And now we're so much further along. It's something to be optimistic about.
Yeah, it's definitely exciting. It's not for everyone though, but
Yeah.
because we don't have a screening test, this was really empowering to me and for you, where we can't go for an annual exam for ovarian cancer. It doesn't exist. We can do everything we're supposed to, look for those signs and symptoms, and we know about our risk factors, but this was a big decision to really reduce our risk. It's so important that we actually can be empowered by that, where science is, and it is exciting that it's something that we can, choose or not to choose.
Another thing I'm excited about now is we're starting to look at the ovaries in a way we've never done before. We're starting to find out much more information. We're starting to learn about the connection between the ovaries and brain health and longevity. I love this focus on the ovaries. It's long overdue. I'm not going to complain about that. At least we're here. At least we're learning about it, right?
Yeah. It affects so many parts of the body for sure.
Absolutely. Absolutely. Well, Pamela, thank you so much again for inviting me down to the T.E.A.L Community Center here in Brooklyn. Such a great space. I always like coming down here. And thank you so much for your support as well. I was so pleased when I was able to talk to you before I headed into my surgery. It was such a great comfort. And I would love to continue the conversation about women's health in any way that we can.
Great. Thank you.
And now we're going to hear from 3 listeners who emailed Overlooked, sent in their voice memos, and shared their personal stories. Thank you, Laura, Jen, and Evelyn. We're all wishing you the best of health.
Hello, my name is Laura Davis, and I'm here to share my ovarian cancer journey. It starts off in a GI doctor's office. I'm waiting for the results of a CT scan. I had picked up the report from the imaging center earlier that morning and began Googling some of the medical terms, which all seemed to point to cancer. So I had a little heads up going into this appointment. The doctor walks in and tells me, "I don't have good news for you." And she lets me know she will be referring me to a gynecologist oncologist. I asked the question, will that doctor do a biopsy to determine if indeed this is cancer? She looks at me with sad eyes and lets me know that it has spread and it is most likely what it is. So I go to the oncologist appointment, and in my head I have a plan. We will go in, she'll do surgery, she will remove the tumors, and I will be relieved of the pain and discomfort and constipation that I've been having for the last several months. But she informs me that there's another plan, a different plan to start with chemotherapy first so that we can shrink the cancer to a manageable size. So when she does go in for surgery, she is able to get at least 98% of the cancer, because that is going to give me the best prognosis. So 2 days later, I'm in the hospital. We are doing a biopsy and exploratory laparoscopy to ensure that the imaging from the CT scan is exactly what's going on inside, which it was. 2 days later, that Friday, I'm still in the hospital and starting my first chemotherapy. I do 2 more rounds of chemotherapy for a total of 3 rounds, and I'm waiting on a CT scan to determine if those therapies have shrunk the cancer to a manageable size so that we can go ahead with the surgery.
My name is Jennifer, and I am about to turn 43. When I was diagnosed in February 2023, I was 41 years old really living the best life I could live. I was very happy. I was running a lot. I completed a half marathon 2 months before I was diagnosed. So I didn't expect to be sick. So when I ran my half marathon, it was the worst race I've ever ran. I was very sick. So I knew something was up. I scheduled it with my primary. He initially thought it was a hernia, which ultimately turned out to be stage 3A ovarian cancer. I had a complete hysterectomy. They took everything, including part of a lymph node. I did chemo, small doses weekly for 18 weeks. And then I was clear for a year. I'm currently in recurrence, and I'm about to get my third treatment. Something that I feel very passionate about that I've noticed is that, yes, there's not a lot of literature on the survivorship of ovarian cancer. I feel like the statistics are very skewed. For example, a lot of the support groups and stuff, it's divided by if you are under 50 or if you're over 50. But when it comes to the statistics and the data, it's not really divided up very well. So I think that also, that's a problem. And that scares a lot of us. We see those statistics and we freak out. Another thing, as I have noticed, is that there's a lot of misinformation. For example, I had my original symptom was a swollen lymph node, which is where one of the tumors was. And they took all but the lymphatic. I'm not really sure what that means. They've not tried to explain that to me. I've asked how many lymph nodules I have there. They don't know. So there's this lack of information that's happening there. I love this podcast. I feel heard. I feel like we're being represented. I would like to see more points of view from those of us that are younger. Luckily, I didn't have kids, or I had decided not to have kids because I went into menopause at 41 because of surgery. There's a lot of us out here that are looking in saying, yes, I have ovarian cancer and I do identify with those experiences, but I'm young. I'm dealing with things that young people deal with, still having to work, needing to work because you need health insurance, but then having to miss so much work because of the cancer. So it would be nice to have some of that representation going both in your wonderful podcast, but also in the medical community. I really appreciate you doing what you're doing.
Hello, my name is Evelyn Molina. I am mother of two, designer, and I live in New Jersey. Here I am today to share with you my story because I want to create awareness of what adrenal cortical carcinoma is. 2 years ago, after the unexpected loss of my mother due to a massive heart attack, I began to feel strange. I began to feel chest pain, developed high blood pressure. I began to gain weight, and my face got really swollen. I thought I was also developing a heart condition. So I went to see a doctor. He checked my cortisol level and found it was really, really high. It was caused by a tumor found in one of my adrenal glands. So to treat it, I had surgery, which was a success. I was cured from Cushing's syndrome, and I was really, really happy. Also, we needed to wait for the results from pathology. 2 weeks later, my surgeon called me to read the results. It was positive for stage 3 adrenal cortical carcinoma, a very rare and aggressive type of cancer that affects 1 in a million people. What does this cancer do in your body? The glands produce an uncontrolled amount of cortisol in your body, which changes the way several metabolic processes work, and that's what affects you. For us as patients, what does this mean? We only have one medicine to be treated with. Also, we do not have enough specialists. Some doctors have only seen one patient with this condition in their whole professional life. And the other complicated thing is that this is a silent cancer. Many times when the doctors find it. And because it's so rare, it takes them a long time to really find what is going on. And then when they find it, it has already progressed to an advanced stage. I also want to emphasize one thing, which is very surprising. There are more female patients than male. Still, doctors do not know why. I just want to leave you with this message. Please listen to your body. In this case, I was my only advocate. Nobody knows how I feel better than myself because nobody else understands it. Thank you so much today for your time. Please take care and don't forget, learn to read your body.
Overlooked is written and produced by me, Golda Arthur. Jessica Martinez-Seos is our producer. We're building a community around women's health so that no one is overlooked. If you'd like to be part of it, sign up for the newsletter at overlookedpod.com. And you can get in touch with us by emailing hello@overlookedpod.com. What you hear and read on Overlooked is for general information purposes only and represents the opinions of the host and the guests. The content on the podcast and website should not be taken as medical advice. Every person's body is unique, so please consult your healthcare professional for any medical questions that may arise. Thanks for listening.